Hi everybody, so we are doing our presentation on the micronutrient calcium.
So what is nutrient? Nutrients are compounds in foods essential to life and health, providing us with energy, the building blocks for repair and growth, and substances necessary to regulate chemical processes. There are 6 essential nutrients that the body needs to function properly: carbohydrates, lipids, proteins, vitamins, minerals, and water. Some examples of carbohydrates include pasta, rice, cereal, breads, potatoes. Some examples of lipids include oil, butter, nuts, seeds, and avocados. Some examples of proteins include meat, dairy, and seafood. Some examples of vitamins include water-soluble vitamin B and vitamin C, and fat-soluble vitamins include vitamins A, D, E, and K. You can get vitamins from fruits and vegetables, grains and cereals, full-fat dairy, and milk. Some examples of minerals include calcium, phosphorus, magnesium, sodium, and potassium. Milk and dairy products are a very good source of calcium, and water, which is a beverage and a component of many foods, especially vegetables and fruits. Next slide. So, are there agents that can destroy micronutrients? Calcium is one of the most important minerals for the human body. Taking medications and eating certain foods can destroy micronutrient. For example, cancer drugs, heartburn drugs, blood pressure medication, heparin diuretics can decrease the absorption of calcium, which leads to having bone loss and increasing the risk for osteoporosis. Osteoporosis is a bone disease that occurs when the body loses too much bone, makes too little bone, or both. As a result, bones become weak. Other agents that can destroy micronutrients and affect absorption of calcium are lectins and oxalates. Lectins are a diverse family of carbohydrate binding proteins found in all plants and animals. Some examples are beans and peanuts. Oxalates or oxalic acid is an organic compound found in many plants. This includes leafy green vegetables. Keep in mind that eating anti-nutrients also has benefits. It has antioxidant and anti-cancer actions.
So the chemical forms of calcium, calcium is our micronutrient. So calcium is never found in nature in a free state. Basically, it's never found as Ca2+, but it is considered a metal. Calcium is most often found as a compound, either naturally occurring or manufactured. So there are some non-nutritional compounds of Ca, which include CaO, which is lime, and calcium bicarbonate, which usually is what creates caves. Nutritional compounds of calcium include milk and dairy products, which have the protein casein, which attaches to calcium phosphate. You have dark leafy brassica vegetables, such as spinach, which contain calcium ions. And it is found also in the bone structures of small fish, such as anchovies or other small fish that you can eat. Now, there are supplement forms of calcium which you can take if you seem to be lacking in calcium. So there's calcium carbonate, which is usually seen as a capsule or tablet, and it provides the body with elemental calcium. And it is also what we see when we pick up those little crystals in the little toy shops, which is calcite. And then you have calcium citrate, which is also another tablet or capsule that you can take. Next slide. So the digestion, absorption, and transportation of calcium. So digestion of calcium, so calcium compounds are dissolved in the stomach via the stomach acid, and then they travel to the small intestine where calcium ions are absorbed. And of course, we can go through the whole from start to beginning. You take in whatever calcium compound, milk, anchovies, brassica fruit or brassica vegetables. And then it travels down your esophagus into your stomach where it is dissolved and then moves into your intestines. Next slide. So the absorption of calcium. So once it hits the small intestine, there are two types of absorption. There is active transportation and passive diffusion. Now, active transportation depends on the availability of vitamin D. Vitamin D is what turns on the synthesis of calcium transport proteins in the intestine. And in order for calcium in active transportation to to enter the bloodstream, it needs to transport past the small intestine, the lining of the small intestine. In order to do that, it needs the calcium transport proteins. And once it is transported past the intestine lining, it uses ATP. And passive diffusion occurs when there is a high concentration of calcium. So it goes from high to low. Next slide. Now, the transportation of calcium. Once calcium is absorbed, it is transported to the organs that need it via your cardiovascular system. The transportation of calcium in blood occurs due to the parathyroid gland. So the parathyroid hormone raises the blood calcium level to help distribute calcium to the needed organs. And the parathyroid hormone is stimulated by the activation of vitamin D by the kidneys. And then vitamin D increases intestinal calcium absorption. The inhibition of calcium transport is due to high levels of calcium, and the hormone calcitonin is released by the thyroid gland, which inhibits calcium released from bones into the blood system.
So calcium is essential in order for our bodies to function properly. Calcium is stored in our bones and our teeth. This allows our bones and teeth to be strong and dense. If a person doesn't have enough calcium, it may lead to osteoporosis or brittle teeth. Another function of calcium is to help promote cell-to-cell adhesion in the cell membrane. So this allows our cells to communicate and send signals out to each other. Calcium also helps us move our muscles. So inside the muscle, calcium facilitates the interaction between actin and myosin during contractions. In terms of wound healing, calcium needs to be present in the blood for the formation of fibrin. Fibrin forms a fibrous network for the blood clots framework. Calcium also helps move blood through the body by helping the blood vessels tighten and relax when they need to. And lastly, calcium plays a role in regulating heart rhythm. In terms of daily needs, the Food and Nutrition Board has guidelines for how much calcium one should consume daily. The recommended dietary allowances are as follows. So those who are 0 to 6 months of age should consume 200 milligrams daily, while those who are 7 to 12 months should consume 260 milligrams daily. Those who are 1 to 3 years old should consume 700 milligrams daily. Those who are 4 to 8 years old should consume 1,000 milligrams daily. Those who are 9 to 13 years old should consume 1,300 milligrams daily. Those who are 14 to 18 years old should consume 1,300 milligrams daily. Those who are 19 to 50 should consume 1,000 milligrams daily. And males who are between the ages of 51 to 70 should consume 1,000 milligrams daily, while females of the same age group should consume 1,200 milligrams daily. And lastly, those who are 71 years or older should consume 1,200 milligrams daily.
So for the sources, calcium is very important for your health. In fact, you have more calcium in your body than any other mineral. It makes up much of your bones and teeth and plays a role in heart health, muscle function, and nerve signaling. However, according to the NIH, a large percentage of the population doesn't meet their calcium needs through their diet. So the main source rich in calcium are dairy products like milk, cheese, and yogurt. However, many non-dairy sources are also high in this mineral. These include seafood, dark green leafy vegetables, legumes, dried fruit, tofu, various foods, and that are fortified with calcium. Next one. So the impact of food processing. So almost all food is processed in some way before it is eaten. Commercially, the main reasons to process food are to eliminate microorganisms, which may cause disease, and to extend shelf life. So simply cooking or combining a food with other foodstuff to create a recipe is also considered a form of food processing. Whatever the case, the nutrient value of any food is often altered by the processing. Processes that expose foods to high levels of heat, light, or oxygen can cause greatest loss nutrients. However, the nutrient value of a food is retained when it's frozen. So in calcium-rich foods, most of them are dairies, which we kept them refrigerated. This will help to retain the nutrient value. So people can drink milk straight after milking a cow also, so it does not have to be processed. In regards to getting calcium from green leafy vegetables, most vegetables are peeled or trimmed before cooking to remove the tough skin or outer leaves. But most nutrients, such as vitamins, tend to lie close to the skin surface, so excessive trimming can make a huge reduction in vegetables' nutrient value. Next slide. So if you have too much calcium in your body, it's called hypercalcemia. So too much calcium in your blood can weaken your bones, create kidney stones, and interfere with your heart and brain work. Hypercalcemia is usually a result of overactive parathyroid glands. These four tiny glands are situated in the neck near the thyroid gland. Other causes of hypercalcemia include cancer, certain other medical disorders, some medications, and taking too much of calcium and vitamin D supplements. Immobility can cause hypercalcemia because bones that don't bear weight release calcium into the blood. Certain drugs, such as lithium, used to treat bipolar disorder, might increase the release of parathyroid hormone, a rare genetic disorder known as familial hypocalciuric causes an increase of calcium in your blood because of faulty calcium receptors in your body. Next one. So some symptoms you might have for hypercalcemia is that for kidneys, you can get excess. This can cause excessive thirst and frequent urination. For digestive system, it can cause stomach upset, nausea, vomiting, and constipation. For bones and muscles, it weakens them, and it also causes bone pain and muscle weakness. And for brain, hypercalcemia can interfere with how your brain works, resulting in confusion, lethargy, and fatigue. And for heart, it's rare, but severe hypercalcemia can interfere with your heart function, causing palpitations, fainting, indications of cardiac arrhythmia, and other heart problems. Next one. So low calcium is called hypocalcemia. The causes you might have are poor calcium intake over a long period of time, especially in childhood, medications that may decrease calcium absorption, dietary intolerance to foods rich in calcium, hormonal changes, especially in women, and certain genetic factors. But the most common cause of hypocalcemia is hypoparathyroidism, which occurs when the body secretes a less than average amount of parathyroid hormone. Low PTH levels lead to low calcium levels in your body. Hypoparathyroidism can be inherited or it can be the result of surgical removal of the thyroid gland or cancer of the head and neck. People with a vitamin D or magnesium deficiency are also at risk for hypocalcemia. And then the symptoms for hypocalcemia won't produce short-term symptoms, but it maintains calcium levels by taking it directly from the bones. But long-term low levels of calcium can have serious effects. So common symptoms can have muscle stiffness, hypotension, changes in mood, fatigue, difficulty speaking or swallowing. Severe symptoms can cause seizures, arrhythmias, CHF, and laryngospasms. And then long-term symptoms of hypocalcemia is dry skin, brittle nails, kidney stones, dementia, cataracts, and eczema.
This is our reference slide, and we are done presenting. Thank you for watching.